So we're now back to our low magnification image of the kidney lobe. Let me search in the appropriate regions of this section and show you most of the named divisions of the arterial supply. An interlobular artery is located in the pelvis region. Since this kidney from the monkey has only got one lobe, this artery is equivalent to the renal artery. Arcuate arteries and veins run along the junction of the cortex and medulla at the base of the pyramid. You can see them as white holes in this magnification, as they have been sectioned transversely. Smaller arcuate veins are sometimes nearby, but a bit hard to see in this image. Now this is an appropriate time for you to consider the lobular structure of the kidney. A lobule is the cone-shaped unit of tissue which is involved in secreting urine from one papillary collecting duct. A medullary ray lies in its centre, and the labyrinth area containing the rest of those nephrons form the outer part. Interlobular arteries branch off from the arcuate arteries and course upwards towards the capsule. They run along the boundaries between lobules, hence their name. Here is an interlobular artery. So this area, the cortex, across to the medullary rays here, and then across to an area about here, where there would be another interlobular artery, but it's out of the section plane here, would be a lobule. So it isn't as easy to structurally define the components of a kidney lobule compared to the lobule of an exocrine gland, as there are not prominent connective tissue elements which border and clearly demarcate kidney lobules. Make sure you can distinguish an artery, in this case the interlobular artery, surrounded by cortical parenchyma with glomeruli from a tubule. Look at the single layer of smooth muscle, circularly arranged in the muscle tunica media, and the elongated nuclei of endothelial cells of the tunica intima here. But note, just epithelial cells in all the tubules. Similarly, make sure you can distinguish a vein, in this case the interlobular vein, from a tubule. Look at red blood cells in the lumen and the flattened endothelial cells of the tunica intima here. But note, again, just epithelial cells in all the tubules.